This is a cervical rotation mobilization. The goal with this exercise is to improve cervical rotation or neck rotation after an injury that's causing radicular pain. What you're going to do is you're going to grab a stretch strap, or you can use a towel or a bed sheet, something like that, and you're going to loop it right behind your neck. You're going to cross it over and grab the opposite side with one hand, and then the other side with the other hand. What you're going to do is you're going to turn your head actively, so you're using active range of motion here. You're turning your head as much as you can in a pain-free manner, and then with this hand, you're just going to add a little bit of pressure into that rotation. And with the other hand, you're just going to pull down a touch. So with my right hand, I'm pulling down to kind of anchor my scapula. With my left hand, I'm helping out that rotation. So it's going to look like this. I'm turning my head to the left. Left hand's giving just a little bit of a pull. Right hand's pulling down. It just adds a little bit of overpressure. Pause for a second and back. Okay? So turn my head, add a little bit of overpressure, and it helps just kind of slide glide those joints to get us moving a little bit smoother after that injury. A good dose for this would be about 8 repetitions, about 2 to 3 sets through. So I'm turning to the left. My left arm is pulling to add that rotation. My right arm is anchoring down my shoulder blade and back. Turn to the left. I'm just adding a little bit of a gentle pressure. I'm not pulling as hard as I can, but it's enough to kind of add a little bit of that kind of palpable pressure. Again, I'm staying in a pain-free range of motion here. If your symptoms are getting irritated, just back off a little bit and see if you can kind of find that pain-free range of motion. About 3 sets, 8 repetitions. To the painful side, if both sides are painful, go to both sides. This exercise is called an upper trap stretch. So the upper trap is the muscle on the back side of the shoulder blade that kind of works to elevate the shoulder. After an injury causing cervical radicular pain, the upper trap tends to guard up. So it's really important to kind of help that muscle kind of find that optimal length tension relationship and try to get that muscle loosened up a little bit. What you're going to do, whichever side you're trying to stretch, so for this video, I'm going to be stretching my left side. I'm going to take that hand, I'm just going to put it behind my back. And that's just going to help my shoulder blade kind of stay out of my ear. So I'm taking my hand, I'm going right behind my back. I'm grabbing behind my head on the left aspect of my head with my right hand. And I'm just kind of tilting my head down as if I'm kind of taking my nose almost towards that right armpit. And we're going to hold that for about 30 seconds. Okay. You can kind of play with the angle a little bit to see if, find that kind of appropriate spot for you. If there's one spot that feels a little bit more tender, you can kind of find that spot. A good dosage here is about a 30-second hold and going for about 3 rounds through. It's good to do this one on both sides. And from the back, that arm is just kind of looping right behind. I'm grabbing the opposite side of my head and pulling down. Staying in the sub-painful range of motion here. So I'm not looking to push into pain or kind of push past any pain barriers. I'm just looking to get a little bit of mobility through those upper trap muscles. All right. This is an upper limb nerve glide. After an injury causing cervical radicular pain, those nerves can become very irritated. These exercises are really good at desensitizing those neural pathways, and they're some of my favorite for that early stages of cervical radiculopathy rehabilitation. What you're going to do is you're going to take whatever side is the more affected side, so whatever side you're having that nerve pain on, and you're going to extend your elbow, extend your wrist, keeping the fingers straight, and you're going to look down at that affected hand. Okay? Then you're just going to come off it. We're not holding for very long. You're going to extend the elbow, extend the wrist, keeping those fingers straight, looking right at your hand, and then just take that pressure off. Okay? Extend the elbow, extend the wrist, and off. So it's like a 1 or 2 second hold, and then we're just kind of bouncing out of that position. A good dose for this would be about 10 repetitions, 2 to 3 sets through. You should feel a nice stretch all along that affected limb. You might feel a little bit closer towards the bicep or the shoulder, maybe even towards the elbow or the hand, depending on the severity of your symptoms. I'm going for about 10 repetitions here. You can do this exercise either laying on your back, sitting up, or standing. So depending on what position you're in. You can do this in any of those positions. It's a great one to do while you're kind of between work calls, if you're sitting in an office chair. It's also a good one to do just if your nerve symptoms are really irritated. Okay. Moving on from there, so we're going to do 2 separate upper limb nerve glides. This next one, what you're going to do is you're going to bend your elbow and extend your wrist, almost like you're a waiter carrying a tray. And again, I'm just kind of looking at that hand as I go, so like you're a waiter carrying a tray, bending that elbow and extending the wrist. And looking away. Same kind of dosage here. We're going to go for about 3 rounds of 10 repetitions. You can kind of break those up however you need. You can do a set kind of in the morning, a set in the afternoon, a set at night. Or if your symptoms are really irritated, you can do a couple sets in a row. But during your day, trying to get through at least 3 rounds, about 10 repetitions here. We're holding for just a second or 2, and then we're getting out of that position. For this one, we should feel that kind of almost like tightening up around our pinky finger if we're doing it right. This exercise is called cervical retraction or a chin tuck. This is a great exercise in that early stages of rehabilitating from a cervical radiculopathy injury. What you're going to do is you're going to take your chin and bring it straight back towards your windpipe. I like to tell my patients to kind of pull their shoulder blades back a little bit when they do this. And then what you're doing is you're taking your chin straight back, holding for about a 2 or 3 count, and then relaxing. Chin goes straight back. It's not a big movement, so you're not seeing a large movement here. But I'm basically trying to almost make a double chin position where I'm taking my chin, moving straight back towards my windpipe. If we do it right, we'll feel our muscles kind of working on the front of our neck and a little bit of a stretch behind our skull or behind the backside of our head. We're going to hold for about 3 to 5 seconds, about 10 repetitions through here. With this exercise, we want to stay in a sub-painful range of motion. So if there's a range that's irritating to your symptoms, just stop a little bit before there. This should be a nice one to kind of get some things moving after that initial injury. This last exercise of phase 1 is called a cat-cow. I love this exercise in those kind of early stages of cervical radiculopathy rehabilitation because we can get things moving without compressing the discs. So we're going to set up in the quadruped position or the hands and knees position. And this is a wonderful position to kind of get some things moving because no gravity will be working down our discs and it allows us to kind of move a little bit freer. So you're going to set up in hands and knees. And what you're going to do is you're going to round your whole back, kind of pushing the floor away through your arms. My eyes are looking right between my knees. I'm going to pause here, take a deep breath in. I'm going to exhale, extending my back. My head is looking up now, so my eyes are looking straight forward. Then I'm going to round my back, kind of making my back look like a rainbow shape. My eyes are looking right between my knees. I'm going to take a deep breath in. I'm going to exhale. And my head is looking up. That breath work is important here because as we take that deep breath in, we're kind of expanding our rib cage. We're getting a nice stretch through the pectoral muscles, through the traps, those muscles that seem to guard up after these cervical radicular type injuries. So it's nice to get that kind of full expansion here at the top as our ribs are kind of spreading apart. Those muscles are getting a nice stretch. We exhale as those ribs are kind of compressing back together. Good set and rep scheme here is about 3 rounds, about 8 to 10 repetitions through. You can kind of break that up however you need to in your day. You can do a set in the morning, a set in the afternoon, a set at night. Just trying to get through about 3 rounds in a day. Taking that deep breath in at the top, exhaling as we come back up.